Dr. Mary Tilak is in the house. Doctor, how are you today?
Good. How are you?
Okay, how's the weather affecting you these days?
Well, it's pretty gloomy, depressing, but we'll make it through
Do you ever treat anybody for seasonal affective disorder?
all the time.
Really?
Absolutely. It's a very common entity. I don't know how many of us recognize it and seek some sort of therapy, but it is very, very predominant.
I hate to say, I hate to say this. I didn't know that. Yeah, I guess I would have never thought that it was like something, I'm just going to say real, but that's not right, because if it affects somebody and it's bringing them down heavily, it's real. You know
Yeah,
what I mean?
I think it's very real. All of us go through some fluctuations in our mood with changes in weather, obviously. But there are some of us who are more prone to having more negative effects on our lives, and that's when we initiate therapy, different forms of therapy.
Dr. Mary, we'll talk about that in a sec. Dr. Mary Tilak is a doctor in what is your exact specialty?
I'm an internist, so I'm a primary care doctor, and that's my foundation in medicine. I also am board certified in clinical lipidology, which is treatment of abnormal cholesterol that leads to cardiovascular diseases. And I'm board certified in bariatrics, medical bariatrics, which is science of weight management.
Weight management's a big one, and we'll get to all those. I did not know that that's what lipidology had to do with the abnormal levels of cholesterol.
Yeah.
You know how many guys are going, oh, I don't want to talk about that. That means I can't have another donut. Hey, the office is on 45th in Highland, just to the west of Indianapolis Boulevard. And what's that address?
That's 2241 45th Street in Highland.
And 2241 45th Street in Highland. Doctor is very busy doctor, and she works out in the morning and has a bunch of people that work for her and tell her where to go and which patient to see next. It's so many people direct her what to do. Here, we're going to run a test. What is the address of your other office?
I'm sorry, I do not know the correct street address, but it is at the intersection of Route 30 and Harvest Drive. That area is supposed to be Cherville in my mind, but for the post office, it's apparently Crown Point. So they have a weird number and an address. I really haven't given much thought to remembering it. The easiest is it's right at the stoplight on Harvest Drive, intersecting with Route 30.
219-845-1100. You want to talk to Dr. Mary Tilak. Tom is on line one. Tom, what's up?
Hey, good morning, guys.
Good morning.
Listen, I've got a question. You hear all these studies regarding the wine, occasionally being good for you. I'm in my mid-50s, and I completely stopped drinking beer. And I admit that on a Friday afternoon, I'll have and share a bottle of wine with my wife. I've been able to lose 15 pounds since that month and a half that I stopped drinking beer. But what really are the good effects of wine? Again, you hear these studies, and it's just kind of confusing, but, am I doing the right thing? I'll hang up and listen to your answer.
Okay, that's a very good question and a very good observation. When you stopped alcohol completely, you lost 15 pounds. So that tells you how highly calorific alcohol could be. And you were probably consuming a lot more than 2, 3, 4 drinks a week. So it adds up to the calories. Each alcohol drink is about 100 calories. So you lost weight purely by...
Is wine more calories?
No, as I said, each an alcohol drink is 100 calories, and
Really?
it is
I always thought wine was more calories than beer.
No, 5 ounces is equal to 12 ounces of beer. 5 ounces of wine is equal to 12 ounces of beer. But if you go and drink a mixed drink, it's higher calorific value because it has so much of sugar base to it.
What
That's all
about
it is.
people that say, well, I'm on like the Atkins diet, so I can only drink straight vodka?
Again, they're looking at it from the concept of it being less sugar content, simple sugar content, like instead of the mixed drinks. But again, I am not a proponent of such drastic measures of cutting out carbohydrates completely, and that is not a balanced diet, and you cannot sustain it for a long time. For the caller who is waiting for the answer on what are the good benefits of wine, the only real benefit of alcohol is going to be an increase in the HDL cholesterol, which is the good cholesterol. But again, that is I never recommend alcohol to my patients to increase good cholesterol because it is such a narrow threshold. It's really very difficult to tell my patient how much to drink in order to do that. The general consensus among the societies, medical societies, is that for a man, 5 alcohol drinks a week, and for a woman, 3 alcohol drinks a week will be the upper limit.
Hi, Brandon.
How you doing? Dr. Mary, what are your thoughts on following a ketogenic diet?
Okay, ketogenic diet. Now, he was just talking to me about Atkins, and that's a ketogenic diet. Ketogenic diets are still a valuable diet under supervision, not by yourself. Because ketogenic diets, especially in individuals who already have underlying diseases and who are on multiple medications, can lead to other consequences. Now, ketogenesis is still a physiologic state. That means it is a normal state. It is not a disease state. There is something called ketoacidosis, which happens in diabetics who are insulin dependent and then stop taking insulin. So insulin deficiency in such individuals can cause ketoacidosis, which is a pathological state. So ketogenesis is a good option for induction of weight loss. So we still use in bariatric practices like us, people who are interested in a quick induction phase because they want to get their motivation up. We could utilize ketogenesis by reducing carbohydrate to almost less than 50 or 40 grams in a day. Then what happens is that there is about 24 hours worth of sugar stores in your body in the form of glycogen. When that is exhausted and you're not providing any more quick sugar, which is the immediate energy for the body has to shift gears to some other type of metabolism. So it shifts from sugar metabolism to fat metabolism. So a byproduct of fat breakdown is what's ketosis.
Right. I've been following a keto diet for the last 2 years now. I consume 50 to 100 grams of carbohydrates.
So you're really not ketogenic now. But when you cross 50 grams of carbohydrates, you're probably out of ketosis, and you're not maintaining.
I test with keto sticks.
Okay.
Probably 3 times a week, and I'm always purple.
You're still ketogenic?
Yes.
Maybe you're more physically active as well. Up to 100 grams, anything above 50 grams is sustainable. I believe
right.
I believe 90 to 100 grams.
50 grams of net carbs.
Okay.
So you try to stay under 50 grams?
No, he's saying over. Did you say you said 50 to 100 grams of carbohydrates?
That's right. I found that I can tolerate 50 to 100, and if I test with the strip, I still stay in ketosis.
How long can you stay up to 100 grams of carbohydrates and still stay in ketosis?
Oh, not every single day.
Correct. That's what it is. So there are too few people who could be you, who could stay within 50 grams of carbohydrates for 2 years.
What do you eat?
A lot of vegetables, a lot of meat, a lot of cheese.
And how are your cholesterol profiles?
I haven't had it checked in a while.
Can you please check it? And I would also suggest that you're probably consuming a lot of meats. Is that correct?
I try to keep my nutrient macros to 65% fat, 30% protein, 5% carbohydrate.
So you're eating a lot of fats. 55% fat is beyond what guidelines are. So and you are probably consuming 2,000 calories?
1,200.
You're on 1,200 calories a day?
Yes.
That is not advisable. And the reason for that is when you restrict, especially in a man, the basic requirements, if you're probably 6 foot tall, how tall are you?
5'7".
You're 5'7". The basic requirements are going to be at least 1,500 to 1,800 calories a day. So I have enough data to show you this. When you restrict your calories to that low an amount, within 6 weeks, your body's metabolism drops down.
Okay.
So you have shifted your metabolism from a V8 engine to a V2 engine. So you're chugging along there, okay? So now, even if you slip and you start eating 200 calories extra, you're going to start putting on weight so fast. You do not. So we do not recommend. What you're on is a low-calorie diet that is ketotic for beyond 6 to 12 weeks. We then transition people beyond the 12 weeks period to a more balanced calorific value. So you will have to get that readdressed.